I grew up in New York City, New York University, Case Western University Dental School. From after graduating, did a little trip around the world, and never let my education interfere with your learning. Mark Twain said that. I didn't have a residency, but I worked in a practice in Borough Park, so we had a pretty good. Everybody would be in different rooms. We could, talk about whatever case came in, and it did a whole gamut of services. And that's sort of really where I got my feet wet. And you sort of need a really broad exposure when you're to dentistry to really see how different areas work together. I think what's really amazing is that most of the people we see here, they are really willing to take responsibility for their health. They're motivated. They come in, and that makes a big difference. And they want the care. When you do the same thing in your own office all the time, it can get stale. And working with young people there's nothing more refreshing. When you work in private practice and whatever background you come from, you have blinders on and you see things only one way. When you come here, it's a whole new world and the way you see people, and it pushes you up against personally on your own boundaries, your own opinions, and you have to confront them and challenge them. And in that sense, it keeps the mind very, very young. When you're in your own private practice, everything is ticking. You're trying to produce. Here, I take what really comes my way. We try to book a full day, but a normal day begins 9 and we work until 5. I think we saw about 9 people this morning. It's like a general practice. There's sometimes you're best left when in doubt. Sometimes it's best to send it out, and sometimes you're just better off that way. They know they can get in quickly. They can be seen if it's an emergency. It's free. That's a big part, and it's all confidential. And people know they can come, and it's safe and it's quick. If you're a dentist, it's a pleasure if you're doing root canals on young people because the canals are not calcified. When you do them in your own practice, you say, send this one out. I think the biggest challenge we've had so far in treating the adolescent here is really a scheduling issue. And I don't think it's that much different than, let's say, even in your own private practice, where you'll get people who want the morning hours, and then they only want the late evening hours. But that's no different than, let's say, also in your private practice, where you have cancellations. And you sit around and you're not doing anything, and that can be very, very frustrating. Whatever you do in life, you have to have some sort of balance. You never reach that balance because your personal life is always changing and your professional life is always changing. So it's sort of like a juggling act of trying to keep everything going and at the same time trying to make each more meaningful. Do I have any career advice? Learn as much as you can. Take as much continuing education and get as much graduate education as you can. Now I can give back the way that was once given to me. So when I do dentistry here, I don't worry about the billing, and I just do dentistry. And that is unbelievably satisfying. They appreciate what they're getting. And that, just in that sense, a simple thank you sometimes is better than a paycheck. It's just you just get a great feeling inside.